Thanks for joining us for today's briefing. This last week has been sadly predictable in this pandemic. Now, we knew that the combination of fewer mitigation measures together with a highly contagious variant would cause this virus to really run wild. And unfortunately, that's exactly what's happening. Among other things, it's making many children sick and keeping them out of school, putting an increased number in the hospital. So we're going to be joined today by some of our pediatric experts who will talk more about that in just a few minutes. But before we get to that, Dr. Dunnigan, would you talk about one of the more frustrating misconceptions that we're facing about the Omicron variant?
Certainly, Alex. We hear from many people that the Omicron variant is milder than Delta and other variants. And many people are interpreting this to mean that Omicron is not as serious and not as dangerous. And that's simply not true. There is some indication that Omicron may cause somewhat milder illness, especially in vaccinated individuals or otherwise healthy people. But how much of so isn't really clear. And again, vaccinations may play a big role in that. What we do know is that even if it's a little bit less virulent than Delta and others, Omicron is still a very nasty bug and can be incredibly serious. Ask any of the people who've become sick with Omicron that have had to be hospitalized, or ask the families of those who've already lost someone to an Omicron variant. In just a few weeks, Omicron has resulted in many more infections than any of the previous variants, and it's caused a record number of people to be hospitalized in cities across the country. The overall toll it's taking on our citizens is unprecedented in this pandemic. Trust the people who are in the hospital. You do not want to get this version of the virus. And beyond the direct effect of the virus, Omicron is also filling our hospital beds to capacity. It's making it very difficult for our healthcare workers to care for many patients. And it's also exhausting our healthcare workers. So Omicron is a potential danger to every patient who gets it, and dangerous especially to vulnerable patients and to those who've been hospitalized for other reasons. Before this surge is finished, Omicron will be responsible for many deaths. That makes it a dangerous virus. By far, the best way for people to avoid that danger is to get vaccinated and boosted. All of the data we have show that if you have been vaccinated, it significantly reduces the risk of severe disease. And if you've been boosted, it reduces it even further. Boosting probably also reduces your risk of being infected in the first place. So there's no question right now that all of us are being potentially exposed to virus in the community. There's so much that's circulating, and vaccines remain the best way to protect yourself, your family, and your neighbors against what's a very serious health threat. The other thing, Alex, that's been bandied around is guidance for quarantining if you've been exposed or you've tested positive, and it can be pretty complicated. Of course, you can find the details at the CDC website, and even that can be a little bit hard to tease through. But the bottom line is, if you are a close contact of someone who has COVID, but you're up to date on your vaccination, including a booster dose if you're eligible, you're not testing positive and you're not showing symptoms, you don't have to quarantine. You just need to be careful and monitor for symptoms. And of course, we advocate that everyone wear a mask when they go out in public. If you've only had the primary series and not a booster if you're eligible, or you're not vaccinated, but you have a close contact, you should quarantine for 5 days. So in that sense, the vaccine really gives us more freedom than we would have otherwise. The bottom line is, the important message is, get vaccinated, or if you've already been vaccinated and are eligible, please get boosted. Recently, the CDC approved giving boosters to people 12 and older. So now we really can get a large proportion of people fully immunized against this virus.
Thank you, Clay. Vaccines are making a huge difference, and it's tough to imagine what we would look like in this surge if we didn't have people that were already vaccinated and boosted. And along those lines, I really wanted to thank all of those who have stepped up and done the right things for themselves and their families and their communities by getting vaccinated. You're really saving the community right now. However, even with all of that, all of the people who have stepped up and done the right thing is still not enough. We keep setting records every day for COVID patients in our hospitals. Our emergency departments are overcrowded, Many of our staff are out, and the ones who are working are exhausted, as you said, and they're worried about getting their own family sick. Now, all of this is already impacting the logistics of running hospitals and healthcare systems and delivering care to patients. And although it's hard to comprehend, we believe it's probably going to get worse over the next several weeks. And so with that in mind, let's take a look at the data we have for today. This first slide that we have is a map of the United States. And as you can see, the Omicron variant is fairly widespread and pervasive across much of the United States. Now, the darker areas are facing the biggest challenges right now, and we're among them. And this map is going to get darker over the next couple of weeks, which is very concerning. Now, as we move on to our normal data that we have, we always start off with admissions. And the number of admissions continues to be unsustainably high. Over the past week, we have set several records, and today we're reporting 194 new patients admitted to the hospital with COVID. Now, those admissions, of course, continue to fill up our hospitals faster than we can keep up. And that means, once again, we have a lot of COVID patients in the hospitals, more than we've had at any point during the pandemic. Today, we're reporting 1,348 patients in our hospitals. And if you look at that slope line, it's really awful because it continues to go straight up. Now, with those 1,348 patients in the hospital, we also have a large number who are very sick and in the intensive care units. And we're very fortunate, at least for now, that a smaller percentage of COVID patients are ending up in the ICU compared with Delta. However, it's still a large number, and it's severely straining our capabilities to take care of people that are sick for other reasons. Now, right now, we have around 216 patients in the ICU, and 138 of them are on ventilators. And this trend line continues to go up as well. To reinforce the point we made earlier about the seriousness of the virus, today we're reporting 22 people who have lost their lives because of COVID. Now, that number continues to be very high, and it's still higher than at any point since vaccines have been available. And this trend line as well continues to go up. As we have said in the past, mortality is a lagging indicator, so we expect to see some of those high numbers for weeks to come. Next, on our reproductive factor, the reason why we believe this is going to get worse is that we still see a lot of virus spreading in the community. Now, we measure this with the reproductive factor, which is 1.64. Now, this has been the highest it's been since we started really keeping track of this number, and that means that a lot of people are getting infected and that the virus is spreading dramatically throughout the community. And next, with our pediatric hospitalization slides, our last slide today shows the reason why our pediatric experts are with us here today. The virus is making more children very sick, and you can see that we have 29 patients under the age of 11 in our hospitals, and 27 between the ages of 12 and 18 are also in the hospitals. And you can also see a number of those children are sick enough to have to be admitted to the ICU. So Clay, would you mind introducing our guests today who can expand a little bit about the impact on the pediatric patients that Omicron is having?
Happy to do it. Our guests today are Dr. Rachel Charney from Cardinal Glennon Children's Hospital and Dr. Jason Newland from St. Louis Children's Hospital. And they're seeing the impact of kids every single day. Dr. Charney, if you could start with, would you tell us what you're seeing at Cardinal Glennon?
Well, thank you. Similar to what we're seeing with the adults in our community, we're seeing a lot of children coming to our hospital, both to our emergency departments and our urgent cares, as well as being admitted in volumes that are higher than we've seen previously with other waves of COVID. These admissions, while sometimes with diagnoses that include things other than COVID, are increased for our kids with symptomatic COVID. Some of these kids are going to the intensive care unit at rates higher than we've seen previously, and all of them are requiring increased resources from an overwhelmed healthcare system. In addition, we're seeing different types of symptoms with the kids that are coming in with the Omicron variant compared to some of the variants we've seen before. A lot of these kids are coming in with upper respiratory symptoms, kids who are getting hoarse and having sore throats or having croup-like symptoms. And sometimes these children are just coming in with gastrointestinal symptoms, so just vomiting and diarrhea and aren't even coughing. So we're seeing a wide variety of symptoms. which for us says that our parents out in the community need to be aware that any type of illness that their child is experiencing right now could be COVID at this time. And we encourage you to both keep your kids home from school and other activities, as well as to get them tested as soon as possible. In addition, we just ask that our families be mindful of what kind of situations we're being involved in. We all want to get our children back to their normal activities, back to birthday parties and events. And unfortunately, with the rise of COVID that we're seeing right now, those things are just not advisable right now. We just recommend that everyone keep that in mind. And I will pass this off to Dr. Newland.
Thanks, everybody. Thanks, Rachel. We have seen the same that Dr. Charney has mentioned throughout. I think it's equivalent in all of our different hospitals, what she's described. I think some of the things that we often have forgotten is the fact that one child could have a mild symptom and get over it, and we've all heard, oh, children aren't that infected, but are that impacted. But we definitely know there's other complications. One of them is this syndrome called multi-system inflammatory syndrome in children. A lot of words that's really equal to a very, very severe illness that occurs in normal, healthy children that get COVID about 4 to 6 weeks later. This illness can land these children in the intensive care unit. And so I think it comes with another piece of this, is that what we have learned is that in our hospitals, they're pretty much unvaccinated. They're pretty much even more so unvaccinated than what you see in the adult hospitals. And so that gets to what are our strategies we can do for our children. And we have to start with vaccination. As Clay mentioned at the beginning, vaccination is one of the keys for us. And we have vaccines, the Pfizer vaccine, eligible down to the age of 5 years. So 5 years on up can get vaccinated, and the age of 5 became eligible for vaccine in November. And I know some parents are out there thinking, okay, maybe I'll wait and have them get their 5-year-old shots and then get COVID and add it. But I would really urge everyone, if you're not vaccinated and your children aren't vaccinated, to have them vaccinated. Clay also mentioned about the boosters, and he mentioned really thankfully and said this, is that the 12 and up can be boosted. I have a 15-year-old who now can be boosted. I mean, she got vaccinated in June. Now, some of your children maybe have just been vaccinated, so are not eligible for boosting, but we really want to stress, let's vaccinate our children down to the age of 5, and hopefully in the coming months, we'll be able to vaccinate all the way down to 6 months of age. Now, that gets to all these younger children, and how do we protect them? Well, number one, we get everybody around them vaccinated. So again, you can hear this theme. We're going to vaccinate because that will protect our children. Number two, we're going to keep our children home that are ill, because that will protect those others that they might come in contact with. Number three, look, we've talked about masks. We're going to continue talking about masks. Masks can work, masks do work. Masks can do work in the youngest of children when they can wear them. We know that not all kids can do that. So the more we can mask around them and prevent that is going to be key. And I think number three, we just got to support one another. That will help our children. That's how we will help our families and others to understand that right now we have an incredible amount of virus. So the more that we can vaccinate, wear our mask, stay home when we're sick, the better off everybody will be, including the kids.
Great. Jason, Rachel, thank you very much for those important remarks. You know, the virus is really impacting kids and the rest of us in unprecedented ways. And we're doing everything we can think of. But it's essential that you do what you can to stop the spread of the virus right now. What you do today will have an impact on our ability to treat patients in the coming weeks. We also want to continue to thank those who are doing everything they should. So those who are vaccinated and boosted, thank you very much. Those who are wearing masks in public and refraining from large gatherings, you're helping in a very important way to keep this from being even worse. So thank you all for joining us today. Please stay healthy and please stay safe.